Good morning and welcome to your Farm and Home Show. I'm Kristi Shive, and this morning we're visiting with Dr. Julie Marfell. She's an associate professor for the University of Kentucky's College of Nursing. Julie, can you first define anxiety and tell us a little bit about what it really is?
Absolutely. Well, actually, anxiety is a part of everyday life. It's a feeling of worry that you get sometimes. Maybe you're restless. Sometimes you can be tense, or you can have that, their spidey antennas up,
Mhm.
meaning they were thinking about impending danger. And honestly, some of these things are very helpful. What's not helpful is that it can get out of control pretty quickly. And if you're having more frequent thoughts, if they begin to be intense, anytime it starts interfering with everyday life and your activities, you need to think about maybe going to see someone about it. Other things that can happen is if you're not sleeping. If you're not sleeping, it makes all the difference in the world. I could go into sleep for hours to talk about it because sleep is so important to your well-being. Some people may feel weak or tired without having done a lot of work. They just don't feel right. Lots of times people have trouble concentrating, which you don't necessarily think about, but if you're having trouble concentrating, that could be a sign that you're anxious as well. And again, if you're unable to control this worry, then you definitely have some anxiety going on. It's not always well understood. Many times it could be an underlying medical condition. Um, Maybe it's some medication that you're on. Certain medications can cause some of these side effects. People with chronic pain may have some anxiety. If someone has been misusing drugs or has been withdrawing from a medicine or from alcohol, many times they will feel very anxious as well. Risk factors sometimes are an existing illness. Again, if you're ill, it can make you anxious.
Mhm.
Increased stress, no doubt. Um, trauma, trauma like in the past can make you anxious. A family history, drugs or alcohol, and other mental health problems. Stress can cause depression. Depression can definitely lead into anxiety. Substance misuse, that can actually do it as well. Again, trouble sleeping. Lots of people may have some digestive problems, and that's secondary to being anxious. Many people have problems with social anxiety, so they're not always willing to go out because they just get so nervous they can't interact. And sometimes headaches can be a sign as well of anxiety.
What can we do if we are dealing with anxiety or somebody that we know is dealing with this?
Well, the best thing to do is to get help early, is to see your primary care provider or to see someone who is a mental health provider. Either one can help you. Stay active makes a big difference. A lot of times, just being more active than you are with exercising, walking is so good for you. And it really does help with anxiety because as you walk, you breathe, a
Mm.
deep breath as you're going through this. Or even sometimes when you're having problems with anxiety and you can't get up and walk, just kind of sit there quietly and take a deep breath. Makes all the difference in the world. You can feel yourself reset. And if one doesn't do it, take a couple more. If you have the ability to spend time with friends, that helps your anxiety as well. Definitely avoiding alcohol and drug use. You know, that's
Mhm.
that's very important all the way around, but that can cause anxiety. And then just taking a minute to be quiet, to just kind of be quiet, close your eyes, and just let yourself be. Honestly, makes a big difference. You can say a prayer, you can reflect, just be quiet for a few minutes. And that settling down that you do can make all the difference. It can get your anxiety down to a level where you're actually able to do whatever it is that you need to do. You can look up box breathing on the web and it'll come right up for you. And that's kind of like building a box. So, and just closing your eyes for a few minutes. Or if you're in a room and you're feeling anxious and you can't like close your eyes or you're not comfortable closing your eyes, just steady breathing.
Today has been such a great reminder that if you are someone who is struggling with anxiety, seek help. As always, you can contact your local extension office for other resources. Thanks for joining us today, and we'll see you next time.